Okay, my name is Matt Johnson. I'm a physical therapist and fellow in training with Impact. And today we're going to demonstrate the biomechanical exam of the thoracic spine. This is to accompany the article by Viti and Stanley. So what we'll do first is we're going to look for positional testing of the thoracic spine through palpation of the transverse processes. So what we'll do here is we'll have Shannon go ahead and flex first. We're going to check flexion. So we'll have her flex through the cervical spine. You can go ahead and cross your arms, cross your chest, flex down, have them round out the thorax. And what I'm going to do is come in with my thumbs. I'm going to palpate for the transverse processes here. What I'm looking for is if one of them is posterior, then my hypothesis is that that side is not flexing like the other side is. So to test that, what I'll do is I'll come in and I'll test my P-pivum, my passive physiological intervertebral movement. So I'm going to push on the transverse process. If that end feel is stiff, then I have to determine if it's due to muscle or if it's because of the joint. So to determine that, what I'll do is I'll check my pavum, which is the accessory glide of the joint. And to do that, I'm going to do more of a supero-anterior glide on the transverse process. And that's assessing the movement of the facet joint. So I'll come in here, do my superior anterior glide. Right now I'm pushing on the right T2 transverse process. And if that is jammed or stiff, then I know that the restriction in movement is from the joint. If the glide is normal, then I'm thinking it's more a soft tissue muscular restriction. So in this case, the article described a restriction in right T1-2 and T2-3 extension. So the patient had problems with right rotation and extension. So we will also assess this extension here with Shannon. And what we'll look for here again is looking at the transverse processes. We're looking to see if one is deep or if one is more posterior. In this case, if one is deeper than the other, to keep it consistent with the article, we'll say the right T1 transverse process is deep relative to the left side. So to test to see if that joint is not extending, I'm again going to check my P-pivum and then my pavum. So in this case, we're checking extension. I'm going to come to the opposite side where the transverse is more posterior. I'm going to do my P-pivum. We'll say that is stiff. And then to confirm that it's from the joint, I'm going to do my pavum, and I'm going to do more of that superior anterior glide on the TP. And what that's doing is assessing the extension on the right side. So in this case, again, to keep it consistent with the article posted, we find a problem in extension. Shannon extends here. I'm palpating the transverse processes. I find that the one on the left side is more posterior. My hypothesis is that the right side is not extending, so I test that with my P-pivum. It's stiff, confirm it with my pavum, and then we now know we have a joint restriction on the right side. Also remember, you always want to compare above and below to make sure what you're feeling is true. And then in this case, we found the restriction, and then we're going to treat that with a manipulation, which you'll see in subsequent videos.